Hello, everybody. My name is Nishtha Sareen. I'm an interventional cardiologist, and I welcome you to our monthly podcast by BIA for You for Them. Thank you for the email requests. A lot of hypertension related requests. So this month, we are going to hear about hypertension from Dr. Shukri David, who is our guest speaker. As we know, hypertension prevalence in women using the 2017 guidelines is close to 56%, which is 1 in 2 women. When looking at people from age group of 30 to 80 years of age, 32% of men and 34% of women are projected to have hypertension diagnoses, and women continue to be less commonly diagnosed and treated adequately and controlled adequately. It is a big deal. It is a big pandemic. So we are very grateful for Dr. Shukri David for being here today as an expert on the topic. Dr. David is the Physician Chair, Heart and Vascular Center of Excellence, Ascension, Michigan. He's the Artman Elslander Chair of Cardiology, Providence Hospitals, and Clinical Professor of Medicine, Wayne State University School of Medicine. Dr. David, thank you for making the time to be here with us today.
Thank you for the invitation. I'm thrilled to be here.
Thank you, Dr. David. Please tell our listeners about the new developments in management of hypertension.
Well, first of all, I think we should know that hypertension is a silent killer. You really don't know that you have hypertension. We see so many young people, their first presentation with hypertension is kidney failure. So it's really important that we appreciate patients who have hypertension, that we diagnose them early, and the management is really, really easy. These medications are very inexpensive. And remember, hypertension is one of the leading causes of death. It leads to strokes, to heart attacks, to kidney failure, all kinds of problems. So it's really relatively prevalent, like you mentioned in the onset, and easily treatable. Some of the new and great treatment strategies now for hypertension is something called renal denervation. And if you'll allow me just to explain for a moment, the kidneys regulate your blood pressure. They send impulses to the brain to raise the blood pressure, and the brain sends a signal back to the kidneys to secrete hormones. It's called the renin, angiotensin, aldosterone system that triggers some hormone release to retain salt and constrict arteries that leads to high blood pressure. So our medications have been targeted toward those the kidneys and these hormones to reduce blood pressure. But recently, the FDA has given approval to two new devices to manage hypertension. Renal denervation, which is basically putting a catheter in a kidney artery that heats up the endothelium or the inner linings of the kidney that kills the nerve fibers that regulate the blood pressure, and also ultrasound waves that can also heat basically liquid and get through into the endothelium of the arteries and into the adventitia where the nerves reside, and again, reduces blood pressure. So basically what you're doing is turning the light switch off. You're killing those nerves or cutting them. One more historical fact, we used to treat hypertension when we had no drugs with sympathectomies, where they'd actually open the abdomen, find the renal arteries, find the sympathetic nerves, and then cut those. But that's a very morbid type of a procedure, lots of complications. It's not done anymore. That was called a sympathectomies. And so that's basically what's on the horizon, is an alternative to pills for the management of hypertension.
Outstanding, Dr. David. It looks like we've come a long way in the management of hypertension. Is this a safe procedure? What is the course after the procedure?
Actually, the FDA has given broad allowance for the management. So if you have hypertension, and you are intolerant to medications, or you need more than one medication, you're a candidate for this procedure. Unfortunately, currently, it's not yet CMS approved for reimbursement to hospitals, so it's out of pocket. However, we do have clinical trials within Ascension that you're able to participate in and have access to that procedure. So we can still do this procedure through Ascension Michigan. Just call our number at the referral line and ask for the hypertension clinic, and we'd be happy to evaluate you for that.
Thank you, Dr. David. What are the 3 take-home points you want our listeners to know about hypertension in today's day and age?
Okay, number one, it's a silent killer. You're not going to have any symptoms. Unfortunately, some of the first presentations of hypertension is an intracerebral hemorrhage or a stroke. So absolutely know your numbers. Know what your systolic blood pressure and your diastolic blood pressures. Know that this can lead to strokes and heart attacks, and the management really can be weight loss and salt reduction. Number three, pills are very inexpensive. You can get your medications for high blood pressure. Literally, it costs pennies. You don't even necessarily have to go to a doctor's office to get your blood pressure checked. Get it at CVS or Walgreens or anywhere. It's easy to do. So make sure you really monitor and know your numbers.
Thank you, Dr. David. Those are really, really important points. It's very important to keep an eye on hypertension because it is a killer. It is a big killer. And you do not want to have ill effects on your health of a condition that is easily preventable. So going into CVS and Walgreens close to you, keeping an eye on the blood pressure or investing in a blood pressure machine is not a bad idea. And if you think you're a candidate for this procedure or are curious, you can talk to your primary care physician and reach out. Thank you, Dr. David, for taking the time for this. Dr. David has also contributed to our book, Bia, She's the Force. We appreciate your time. Thank you for making it to the podcast today. I thank all the listeners for being here today, and we'll see you next month with a new topic. Take care and stay safe.
Thank you.